Good morning, everyone. Now, I'm about to show my age, okay? I love this place, don't you? I mean, besides the fact that it's one of the most beautiful buildings I've ever been to in the centre of London for an event like this, it's when they ring that bell and it takes me right back to being at primary school. And I'm imagining right now that somebody's about to get the little milk bottles out so that we're ready for the break time. Anyway, look, it's really nice to be here. My name is Jono. I have a brilliant privilege this morning and today of chairing this event on behalf of the GovNet team. And so welcome to the Patient Safety 2023 event. Now, if you're thinking, oh my God, I was supposed to be at the mental health event, that's just across the way. So if you sneak out quietly, we won't hold it against you, all right? But if you are in the right place, welcome, and we hope that you're going to enjoy all of the speakers that we have for you today and the sessions that you will be involved in. On the stage, I will introduce them in a moment. We have our speakers for the morning session, and you know that when they've finished, you can sneak out and get a cuppa, so that's always good. So it's their fault if we're late, all right? And we're just going to have a great morning. I'm going to kick us off. I think I've probably got the longest job title in the world, but that's probably because I actually have two jobs at NHS England. One of them is in personalised care and the other is in quality improvement. But before I worked for NHS England, I was just myself. And what I want you guys to do is get involved here now, okay? Audience participation is allowed, and you just need to be loud when I ask you questions, all right? And if nobody answers, quick warning, it's the front row that gets it, just like at a comedy gig, okay? So guys, you sat there, well done, all right, well done. So, I want you to use your clinical observation skills for a moment, please. Would somebody like to describe me? Come on, don't be shy. And right, go on, who's going to do it? Glasses. I wear glasses. Vivacious, thank you very much. Anything else?
Alert.
I'm going to step back because I can hear that echoing and it's really getting me.
Alert.
Alert. Gosh, do you know what? I used to like the old Keep Britain Tidy campaign. Or the one that I used to go with, be alert, Britain needs alerts. Okay, so I'm alert. Okay, anything else? I'm really surprised at the moment. Nobody has gone for fat white bloke. I mean, let's just be honest. It's fine, I'm okay. I'm clinically obese, it's absolutely fine. Too knackered to do the exercise. Anything else? Scruffy. I love you. Who said that? Go on, brave it up. Brilliant, I love it. I am scruffy, that's just me. You know, dragged myself out this morning, I went through a hedge backwards and this is how I turned up, it's fine. Anyone want one last guess at what I might be at? One more observation. Angry. What, that nobody's got the clue yet? No, you're absolutely fine. This is a patient safety event. And what's really important in patient safety is the patients. For all my life, I've been a patient. Now, knowing that I am a long-term healthcare conditions patient, does anybody want to take a guess at a condition? And, you know, it can be anything. I won't take offence. Diabetes. Okay, I'll give you that one, but it's secondary too. Yeah, somebody wants to say type 2. Anyone ever heard of type 3? Yeah, cystic fibrosis-related diabetes. And that gives you the diagnosis now, doesn't it? But what's great is I don't look like a CF person. I'm not thin, I'm not small, and in fact, that exact problem of not being atypical was why I didn't get my diagnosis of CF until I was 35. And now what's even better was I was diagnosed by the most extensive organisation in respiratory medicine in the UK, the Brompton Hospital, as bronchiectasis. Right the way through from about 11, when I had my first ever chest x-ray, because somebody thought, oh God, he's always got a chest infection, all the way through. I've also, unfortunately, had the great experience of having two never events happen in my life. Thank you for one surgeon who decided to leave a pad behind whilst they were cleaning out an infection. Really good of you. Meant I had to go back to theatre about 20 minutes after coming around. And then thank you very much to The very poor nurse, David, he was a great senior nurse who, very unfortunately, in a rush, whilst putting an NG nasal tube in, decided that it was okay to leave it in my lung and aspirate me for a little bit. Now, what was worse about that, actually, is I could sit here and go, what a terrible thing that's happened to me. Isn't that awful? But actually, what was worse for me in that situation was David's response. He was utterly gutted and hurt and upset that he had caused pain or issues for me in my condition. To the degree that actually, for about 6 months after, he couldn't go anywhere near somebody with an NG tube in. Secondary harm, the harm to staff that happens when patient safety incidents happen, is completely under-recognised in the health service. But involving patients and allowing them to tell their stories, or as I say, their evidence, enables staff to get over it and enables staff to see it wasn't their fault. There was an issue on the day. I was a bit uncomfortable and probably coughed in the wrong direction. Lots of reasons for those things happening. But we need to ensure that when patient safety incidents are happening, we are looking after not just the patients, but everybody involved in patient safety. So, a bit more fun for you. Which pocket did I throw them in? It's always silly. Don't put the mic pack on top of the magic trick. Don't do that. It's really not clever. So I'd like to have some fun with you. And one of the key things for me, let's just look at the audience for a second. Yeah, I reckon. Right. Put your hands up if you're clinical. Yeah, I knew that was going to be the case. This is you lot. Yeah? This is the most people in the room, okay? And quite often in my world, the most people in the room are the clinical people. Can you put your hand up if you're management or oversight in some organisation? Yeah, okay, brilliant, that's great. I reckon that's that one, right? Now I often do this one, and nearly half a dozen people put their hands up until they realise what I mean. Can you put your hand up if you're a long-term conditions patient? Oh, actually, that's closer than it's been for a long time. Welcome, and it's absolutely brilliant that you guys are here. Most of the time, though, we're the smallest bunch in the room, aren't we? We're usually the ones that aren't all that listened to. But in the patient safety strategy, there was something really important that happened in 2019. And I know it happened in 2019 because in 2018, I bloody well wrote it. And it's in the patient safety strategy. And it says this, that all organisational boards should consider recruiting at least 2 patient safety partners to their organisation to work with their board. And the idea of that was this. It was bringing people together. So right now, I'm just going to bring all of these people here together. Now, what's really good about when you bring people together is, actually, it equalises people. So we get an equalisation of power, an equalisation of voice, and an equalisation of outcome for everybody. So it really shouldn't matter to us whether or not we are the clinician in the room with the biggest voice, the one thing that often happens, or the management in the room who think they really control everything but probably don't, or the patient in the room who's desperate to have their voice heard but thinks that their voice is only so heard. What's important is we bring in patient safety those things together, people together, to really understand how we can benefit each other to get the most out of the strategies that we have around patient safety. A way that I like to think about that is when a clinician is asked to go to the board and talk about something that's gone on in the world, often they are asked to present their evidence, the results, the data, the information as to why something happened. When a patient is asked to go to the board, Why are they asked to tell a story? The stories can be made up. A story may have some facts, it may be incorrect, but it's just a story. My saddest point as a patient and doing this sort of work was when I had the joy of being an associate non-exec director, and I don't mind naming and shaming, it was at Northern Devon Healthcare Trust. And one day the chair of the trust said, it was really good, we've got a story coming from a patient. The patient came in, told what was actually quite harrowing, quite a deep, meaningful, and actually easy to resolve story about how they'd been poorly treated and actually felt that they'd been racially abused. Terrible thing that had happened and was easy to resolve. At the end of the story, the chair of the board sat there and went, thank you very much for telling your story. We're about to take a break, so if you'd like to leave now, that's absolutely fine. And before the door had even closed, somebody in the board said, right, now we can get on with the real business, can't we? And if that's the culture in which we're living, where if a patient speaks to us, it's just a story, but if somebody else comes, it's evidence, then actually we're getting patient safety wrong. The strategy was delayed, had lots of issues around because of COVID, and I've also been quite clear that I've said this several times directly to the team at NHS England. We failed when we put the strategy together because we didn't fight for the finance that was needed to support it. So when we talked about patient safety specialists and we talked about patient safety partners, we failed to guarantee the money that would ensure that they were put into place and put into place properly. And so as part of the team that wrote that, I'm sorry. I'm sorry that we failed you to get you what you needed to resource patient safety well. I'm not sorry for the fact that we told you that you could do it better and that we gave you the tools to help you do it better. Quick example of that. Is there somebody from a trust here? Wonderful. Can I ask either of you, can you name your patient safety specialists?
I only know the name of the head of safety and nursing.
Okay, so you know the head of the name of safety and nursing. But you should, by law, and the patient safety strategy, have 2 patient safety specialists as a minimum. Would it shock us to then know that you also probably can't name the 2 patient safety partners, members of the public with lived experience? Can I ask, is anyone in this room able to name your 2 legally required patient safety partners? 1, 2, 3, 4, 5, 6, 7, 8. I love you all, thank you very much. It's really important we get to know who is involved in patient safety in our organisations. And I really want you, after this, in your organisations or where you work, to go and find out who are the members of the public bringing their lived experience into patient safety. Okay. I'm going to sit down for a second. I thank you for listening to me and the opening remarks, and I will introduce our speakers for the rest of the morning.